Hello, dear students. Welcome to Pathology Part 7. Today we will learn about the collection of blood specimens. Before we started, subscribe, like, and share this channel. This lecture includes three system methods for blood collection. First, via syringe. Second, Vacutainer system. And third, by Lancet. Before the drawing of blood, basic steps and requirements are needed for patient care and precautions. So, let's see the basic steps for drawing a blood specimen. First, preparation for blood collection. Each request for a blood specimen must include a number to identify all paperwork and specimen associated with each patient. The information given on the blood request form should be recorded on the specimen labels. The specimen container should be labeled appropriately before the specimen collection. Second, the ascertaining the patient has fasted or not. Some test requires the patient to fast. Such care is needed to ensure accurate results. Third, reassuring the patient. The technician must gain the patient's confidence and assure him that although the venipuncture will be slightly painful, it will be of short duration. Fourth, the positioning the patient. The patient should be made to sit comfortably in a chair and should position his arm on a slanting armrest, extending the arm straight from the shoulder, and it should not be bent at the elbow. If the patient want to lie down, let the patient to lie comfortably on the back. The patient should extend a arm straight from the shoulder. For support, a pillow may be placed under the arm. Requirements for blood collection. The collection tube, sterile syringe or needles, or cotton balls or a gauze pit is the primary requirements for blood collection. So, the important instructions must follow during the blood collection. First is the checking the paperworks and tubes. Second, identify the patient properly. Third one, the use biosafety equipments. Fourth, allow the alcohol. And fifth, selecting vein shed. For most venipuncture procedures on adults, vein located in the arm are used. The median cubital vein is the one used for the patient. If the venipuncture of this vein is unsuccessful, one of the syphilic or basilic veins may be used. The blood, however, usually flows more slowly from this vein. Before attempting to draw blood from ankle or foot vein sites, a physician should be consulted. This site should not be used in a patients with diabetes or a cardiovascular or circulatory problems. 6. Do not touch the venipuncture site after cleansing. 7th. Applying the tourniquet or a belt. 6. Remove loosen the belt before drawing the needle from the vein. 9th. Avoid collection from arm side. 10th. Discard the used needles in sharp container disposal. And 11th. Hand rub and hand wash to be done after each collection. So, first we see blood collection through syringe. Inspect needle and syringe before use. Clean the area site. The patient arm is gripped tightly and thumb of another hand is used to draw a skin tuft. The vein is penetrated by positioning the needle at 30 to 40 angle. Initially some resistance is encountered But once the point of the needle passes through the vein wall, the release of resistance is felt. After blood has been drawn, a patient should release the feast and belt is also released. A cotton ball is held firmly over the venipuncture site as soon as the needle is removed. The patient may remove the cotton ball after 5 to 10 minutes. If patient continues a bleeding, pressure is applied to the site with a gauze pad or a cotton ball until bleeding stops. Fifth, after removing the needle, the collected blood is dispensed in the appropriate tubes. Syringe and needles are discarded. If the blood in the anticoagulated tube is mixed carefully and blood collected in the tubes. Second, blood collection through Vacutainer. Holder to secure needle during insertion into tube stopper and subsequent venipuncture. Sterile Vacutainer tube. It is an evacuated glass tube with rubber stopper containing pre-measured vacuum. Vacutainer brand needles are specifically designed. The needle has two ends. The cannula tubing from which the needle is made is starved at one end for puncture of the skin and vein. A plastic hub is at the center with screw into the holder. At the back end is a much shorter cannula. The rear cannula has a rubber sleeve. During the blood collection process, the rear cannula pushes through the rubber sleeve and puncture the rubber stopper, allowing the vacuum in the tube to draw blood from the vein. When one tube is withdrawn for the back of the needle to collect blood in another container, the sleeve slides back into the position and keeps the blood from flowing out through the rear end of the cannula. When the last tube has been filled, the entire assembly is removed from the patient's arm and needle is disposed. The main advantages of Vacutainer system. It minimizes the hemolysis in specimens and it ensure accurate blood to additive ratio. The third method is throughout the lancet. A lancet device is used to make a small puncture in a skin, allowing a few drops of blood to be collected. The blood is collected into a capillary tube. The main advantage of lancet collection is a relatively painless and a minimal invasive method. These methods used for glucose monitoring, blood group typing, and other point of care testing. So, the last important topic is to hemolysis of blood. What is the hemolysis? The hemolysis means the liberation of hemoglobin after red blood cells have ruptured or burst. The serum or plasma assume pink to red color. In venipuncture, hemolysis may occur from the reason is the using a small needle, very small needle. Second, the forcing the blood through needle, sucking the tube vigorously after collection, and excess of anticoagulant in the tube. So, if you have any problem related these topics, kindly comment on this channel. We will surely solve this problem. Thank you for watching.